Hi everybody, welcome to Dr. Harry's Healthy Corner. I am Dr. Harry. Today I wanted to take this opportunity to do a little refresher on Alzheimer's disease in honor of Alzheimer's Awareness Month. I know we did a little bit of informational on dementia prior to this. We talked a lot about signs and symptoms and diagnoses. Today, what I really just wanted to focus on is some interventions that we can start instituting that can decrease our risk of developing Alzheimer's disease. As many of you know, there is no cure for Alzheimer's currently. Treatments are primarily geared towards delaying the progression of the disease. As many of you know, many people are impacted by this disease, and it's not only the person that has Alzheimer's, but it is also the person that is taking care of them that also gets impacted. And so this is really, really important. As the population ages, we have more and more incidences of Alzheimer's disease. So this is really important to talk about. The first thing that I wanted to say is we wanted to take a look at perhaps what might be occurring in Alzheimer's disease. While we do not completely understand the full mechanism behind Alzheimer's disease, we've noticed some things that seem to be consistent in the progression of Alzheimer's disease. One of the things that we notice is that there's a buildup of two particular proteins that are very toxic to the brain in high amounts. Those are the amyloid beta proteins and tau proteins. The other thing that we notice is that there seems to be a decrease in blood flow to the brain, and therefore there's going to be a decrease in nutrients to the brain, and the brain cells are going to suffer from that. Another thing that's really important is that there's an increase in inflammation in the brain, and as we know, inflammation contributes to lots and lots of chronic illnesses. And the final thing that is noticed is that the brain starts using significantly much less energy. And so remember, the brain uses about 20% of the body's energy, metabolic energy. And so when the brain is incapable of really utilizing that energy with maximum efficiency, you can see where the issue can start happening. So based on that, what are some interventions that we can do to help reduce our risk of Alzheimer's disease? Well, one of the things I wanted to talk about is a very interesting diet called the MIND diet, M-I-N-D. And that diet is really a combination of two diets that many of you are familiar with, a combination of the Mediterranean diet and the DASH diet for hypertension. So MIND stands for Mediterranean DASH Intervention for Neurodegenerative Delay. So it's primarily a diet that's focused on delaying the development of Alzheimer's disease and dementia symptoms. So what is involved in this diet? Well, interestingly, the diet is not very laid out and detailed. It's a combination of the Mediterranean and the DASH, but it takes the best of these diets and put it in a way that the average person can really start incorporating these changes into their diets relatively easily. So here's some of the things that's on the MIND diet. Green leafy vegetables we talk about ad nauseum, but this diet encourages us to have at least 6 servings a week of green leafy vegetables. So that includes kale and collards, and even broccoli is mentioned here as well. This diet also includes, yes, nuts. And it encourages us to have about 5 servings of nuts a week. And so you need nuts such as walnuts and almonds. And the other thing that it encourages as well, beans and legumes. And so these are like things like black beans and lentils and chickpeas, and 4 servings per week is suggested in this case. It also promotes the use of berries. So strawberries and blueberries at least twice a week. It could be more, but at the very least 2 times a week. Now notice the MIND diet doesn't really emphasize a lot of fruits, but it does particularly mention berries based on the significant benefits that berries seem to offer to the brain. It encourages us to eat fish at least once a week, perhaps more if we can. Poultry at least twice a week. And it also encourages us to limit our red meats as well. So red meats should be limited to about less than 4 times a week. The part that many people may not like so much is that it does limit cheese to less than once a week. And it also limits butter to 1 tablespoon a day. So it doesn't say that you can't have any butter, but it does say you can have about a tablespoon a day of butter. And the concern here might be saturated fats. Now, while there's some debate on saturated fats and heart health, the studies seem to be relatively consistent with saturated fats and brain health. So those are the things that that we are talking about here. Also, fried foods are a big no-no, and we want to reduce our consumption of processed foods and high sugar foods such as pastries and our dessert type foods to limit it to about 3 to 4 times a week. So again, you can have a little bit of something dessert-wise, of course. Whole grains are included in this, and this is really fantastic, at least 3 times a week for whole grains, because whole grains, again, provide good fiber to the gut. We know that good bacteria helps to keep our mind working, our brain cells working really well. So fiber is really whole grains are really encouraged here as well. So here you see it's more of a guideline as to what foods to include, how many times to include these foods. So it really kind of gives us a little bit of a template as to how to start incorporating this diet into our lifestyle. The other things that may help to reduce Alzheimer's disease are things we discussed before. Exercise. Study in University of Queensland suggests that high intensity exercise seems to be the exercise that increases blood flow to the brain more efficiently. Keep in mind, yoga and meditation are also very much linked to healthier brain cells. Now, loneliness is actually a risk factor for increase of dementia. And so all of us, we want to feel bonded to something and someone. And so loneliness is a really significant risk factor. So it is encouraged to go out and socialize and interact with your friends and have a friends night out. Also, good relationships are important. What might be happening here is that when we feel bonded and warm and fuzzy, that actually increases and changes the brain chemistry and increases particular chemical in the brain that's very nourishing and fertilizing to brain cells and helps to protect them from damage and oxidation. Okay, sleep is really important. I know we talked about sleep, but what the Mayo Clinic has found out is that people who suffer from sleep deprivation, what happens here is that they have a significant buildup of one of those toxic proteins that we were talking about. So here you start seeing the importance of sleep. And we also know sleep contributes to chronic illnesses such as diabetes and hypertension, and those have also been linked to increased risk of Alzheimer's and dementia. So here you can start to see where lifestyle interventions can help us not just to protect our heart, but to protect our brain as well, protect our blood vessel. And so what we want to do as we go into this holiday season where there is an abundance of food, keep in mind the guidelines of the MIND diet and be sure to include some of those foods on the MIND diet into your Thanksgiving meal and well into the holiday season as well, and your brain will thank you for it. So until next time, this is Dr. Harry signing off from Dr. Harry's Healthy Corner. You have a very pleasant day and happy Thanksgiving. I know it's early, but I won't be on next Wednesday. Until then, bye-bye.